too. All right. Lindsay Mumma, DC, DNSP.
A lot of letters. So many things.
So many things. We're here to talk about something that nobody wants to talk about.
I do.
Yet, I know. Well, you do. That's why you're here, because you're actually the woman who's talking about these things.
Yep.
But women, we're not talking to each other about these things. A little bit. Everybody has the one friend who's like, every time I sneeze, I pee my pants. And then you're like, what? Oh, what? Oh, no.
Oh, no, that never happens.
Not me. Yeah. My vagina's perfectly taut. And yet, here we are.
Here we are.
Your book is titled Your Pelvic Floor or Why Your Pelvic Floor Sucks.
No, it's just Your Pelvic Floor Sucks.
Your pelvic floor sucks. Like it's
in your face is what it is. Yeah. And that's intentional. So what's funny is that there's a like kind of medical textbook community. They want to publish my book because I self-published, and they're like, how do you feel about a title change? And I'm like, I'm making you uncomfortable, aren't I? Like, it's not just in lay people that there's discomfort talking about pelvic floor dysfunction. It's in medical professionals. And that's why I titled the book Your Pelvic Floor Sucks, because two things are true. One, at least 1 out of every 4 women has some amount of pelvic floor dysfunction. We also see it in males, but it's higher in women. And we know that number is underreported. So that's 1A. That women are not speaking to their doctors about this. And B, the only thing that people know how to do with their pelvic floor is a Kegel exercise, which is when you suck your pelvic floor up and in. So truly, your pelvic floor sucks. And the only thing you know how to do with your pelvic floor is make it suck more. And it's not working because people are peeing their pants all of the time and they're not talking about it. And, it's like a hee little thing that we just brush under the table. And I argue that if every single time that you sneezed, some amount of fluid crept out of your elbow, you'd probably want to get that checked out, and you wouldn't just laugh it off and slap a pad on it. Like, you would further investigate, why is this part of my body that henceforth continues to leak? Why did that start, and how is that happening? And can we get to the bottom of it? Then the problem is that because the medical professionals are still a little bit uncomfortable talking about a pelvic floor, they don't get anywhere with it. So I presented at a conference, and it's the largest chiropractic conference. So there's a ton of people there. And I really thought that I was going to be kind of under delivering. I was nervous about my presentation. I was like, okay, I've presented this to students before, and it's mind blowing to students because, they haven't learned this stuff in school and it's not real covered in school. But like, surely when you get out of school and you're in practice and you hit the real world, you realize like, oh, I guess I better brush up on some things that I didn't learn well in school. And I had a line of people, and specifically I had a line of like 50-plus-year-old men who were asking me questions about where they learn more about pelvic floor stuff, because they're like, I didn't even think I treated pelvic floors, and I didn't realize that I had one. I was like, oh God, we have so much work to do. And so I was like, screw it, I'm going to write a book. And I wrote a book. And
okay, well, we're gonna get to the dudes in a second.
We'll get there.
They always
the dudes.
Listen, dudes, I love y'all. And if you're a dude listening right now, we're gonna get to you. But if you're a dude listening right now who's with a woman who maybe has brought some things up to you, first of all, good for you for listening. Mm-hmm. Second of all, there might be some interesting information that you want to pass along to your lady. Okay. And the reason why I say the dudes have to wait is because generally, women, we're used to not having anything tested on our body. So you guys get all the tests. So now we're just going to take the stage for a minute. Just a minute.
Yeah. And I will say, so, like we can yell about the patriarchy and how we haven't studied women. Women are hard to study.
We are.
Because if you take me in my luteal phase, and then you're comparing me to someone else's follicular phase, and I had a really stressful follicular phase, like now my hormones are throwing off whether or not this intervention is working or isn't. So we're hard to study. I get it. We are a challenging breed, and that's
Absolutely.
What makes us special.
That's right. We're very special. Okay. So first of all, let's just take it. Let's take it way back. And if you could please define pelvic floor dysfunction and maybe give us like a little pelvic floor 101 anatomy and physiology lesson.
I would love to. So pelvic floor dysfunction is any number of, I hate to use the word in the definition, but any number of dysfunction. So something that is not working well within the area of the pelvic floor. So the pelvic floor consists of the space between the pubic symphysis, which is your pubic bone at the front, like the thing that you occasionally run into and you're like, why does that hurt? I'm not a man. And your tailbone or your coccyx. So there's a sling of muscles that goes underneath of there. And I'm just going to take a small little tangent here, because this is what makes me so upset about how underserving we are of people who are dealing with these types of dysfunctions, because it is a multi-layered, multi-directional area of musculature. And there's one exercise that anyone knows about it. Whereas you think about the biceps, right? So these are two muscle bellies. They go in the same direction. They have an attachment and insertion. They do effectively one thing and then reverse it. And that's the end of it. And you ask anybody off the street and they could name you at least 3 exercises for the bicep. You ask a manual therapist of some sort of professional and they can name you 15. You ask them about the pelvic floor, which has muscles going in different directions and 3 layers with 3 holes in it for females and 2 holes in it for males. And they can tell you 1 exercise. Yeah. And so that's like, it's frustrating to me. But when we are talking about pelvic floor dysfunction, typically we're referring to stress urinary incontinence, which is you laugh, cough, jump, or sneeze, and you leak some amount of urine. Or stress urinary incontinence, urge urinary incontinence, which is you have the urge to go to the bathroom and you then leak urine before you get to the bathroom. So there's kind of like a mismatch of the communication of my bladder is full.
I call it the anticipation. You can't get to that point where you have to pee so bad, because when you get within 20 feet of the bathroom, you'll start to pee in anticipation of making it to the toilet.
That is urge incontinence. And then there's also mixed incontinence, which is a combination of those where, like, if you laugh, cough, jump, or sneeze, you have some amount of urine that leaks, but then also you have it with an urgency as well. There is also bowel incontinence, which is the leaking of feces unintentionally. In laughing situations,
but it makes sense.
Call it a shart, but that's bowel incontinence is a real thing. And it's a very disruptive thing for people's daily lives. And then there's also prolapse. So prolapse can be of multiple different organs, but effectively those organs have shifted downward into a place where they don't belong. So
I've heard of that, like with the uterus, the uterine prolapse,
the uterine prolapse. And so the cervix will actually slip down into the vaginal canal. And so then sometimes women feel a fullness or a heaviness in their vagina, almost feels like they have a tampon in when they don't have a tampon in.
Oh, wow.
And you can also have the bladder prolapse into the vaginal wall. Like you could also have the rectum prolapse. So there's, and then we also have, vulvodynia, coccydynia, pain within the pelvic floor. Those are also forms of pelvic floor dysfunction. So it's kind of a broad array of symptomology that we see in this one area, but it's such a complex area and it's such a super important area. It effectively helps us to get blood flow and lymph drainage to and from our lower extremities and then back up into our torso. It has functions in breathing and in posture, which is where I think a lot of the dysfunction is coming from. And because most people are not at all having a reciprocity of their diaphragm and their pelvic floor working together for breath, and then therefore they don't have it for posture. And that's what a lot of my book kind of is like, really diving into making sure that those work together. And then it also has functions sexually. It also has functions reproductively. So sexually for pleasure and also for reproduction. And it is like the driver of our fertility. And it's also the base of our support. So we're the only mammals who actually have full weight of our torso on our pelvic floor. All other bipedal mammals have some amount of tilt where their skeletal structure is actually more holding up the rest of their torso, or the anterior, like the front part of their abdominal wall, meaning like the front part of their stomach. But we as bipedal creatures have our pelvic floor directly underneath of us. And so we have a ton of pressure on our pelvic floor all day. And if we're not managing that well, then things tend to go awry, which is why we have an underreporting of at least 1 in 4 women who have some amount of pelvic floor dysfunction.
So I always think to myself, well, it's got to be, all of the mishigas that happens with carrying a child, delivering a child. But now that you put it that way, I think there's got to be weight issues. Wow. I never even looked at it that way. There's
a ton of things that can impact the pelvic floor. So there actually, there's one study that I shared in my book of bariatric surgery in obese adults actually led to a decrease in pelvic floor dysfunction. So there is simply like a weight
Just
management standpoint.
losing weight will help. Yeah.
Smoking cessation can also help with some pelvic floor dysfunction as well, if that's appropriate. So, I mean, it's just, the body is one unit, and it is a closed kinematic system is kind of how we refer to it in manual therapy, meaning that the foot bone's connected to the leg bone. And so if you can think of that song and realize that every single thing that you do impacts every single other part of your body, the pelvic floor is kind of the center piece of that entire thing. And so it's sitting there underneath of all of your major organs, and it's effectively bearing the weight of your entire torso directly upon it. And then it has to effectively relax and release in order for us to pass urine, in order for us to pass feces. And then it also has to create stability in order for us to be able to take a step, let alone cough or sneeze or do anything that actually like has an increase in pressure on our pelvic floor. Like, it has so many tasks to do all day, every day. And we're just sweeping it under the rug. Not a problem. Doesn't matter that it doesn't function the way that I want it to. I've been potty trained since I was 2, and now all of a sudden I'm peeing my pants, and I just laugh it off and don't even tell my doctor. Right. So I really I named the book Your Pelvic Floor Sucks because I wanted people to start paying attention. And I'm, kind of a don't
change the name. Don't listen to them.
Yeah. So
don't listen to those people.
I get what they're saying, right? Like, they want to sell this to doctors, but that's the problem, is that nobody has thus far been willing to really hit this head on. Yeah. It's an aggressive title, but we need
I want to sell this to every woman ever.
Thanks.
Now,
and to every man too, because women they're suffering from this, and they're not talking to people about it. And then it's just like,
and how does it present in men?
So men have they don't generally tend to pay attention unless it starts to affect their sexual function. But so after a prostatectomy, so if men have their prostate removed, about 20% of them will have some amount of pelvic floor dysfunction, where they actually will have difficulty with urine output or stopping the flow of urine, or they will end up with some amount of erectile dysfunction, like up to a year post-operation. And so that's usually when they're paying attention. But oftentimes men will have men can have pain that affects their pelvic floor. And for the same reasons that we were just talking about, right? The pelvic floor is so involved in how we move and how we do anything in our life, that if we have imbalance in any of our muscles in the way that they fire, then the pelvic floor is just it's the centerpiece. So it's right there in the middle of all of the action. So if your glutes aren't working very well, when you go to hinge yourself up out of your chair, you'll create more tension in your hip flexors, and you'll create more tension in your pelvic floor, just because they're neighboring muscles. And so they're like, okay, well, you can't get your butt up out of the chair. We've got to bring some other friends to get the job done. And so we'll create more tension. And then, you have the, people just walk around holding tension in their muscles all day, every day. The upper traps are one of the key ones where
I want to shake out my traps. I'm
so much tension in my traps. Yeah. Well, of course you do, because you've asked those to stay tight all day, and your brain's like, okay, I'll acquiesce to that request. And the tension that lives there is mostly because of breathing mechanics. And so if people are breathing up into their chest, then their upper traps get tight, but then their pelvic floor reciprocates and also gets tight, because there's not adequate intra-abdominal pressure kind of functioning between the diaphragm and the pelvic floor. And so the pelvic floor is like, I guess we'll get tight. But the same way that if you walk around with your butt squeezed all day, eventually you start to develop trigger points. It becomes uncomfortable to just be able to have full range of motion of those muscles. So then that leads to pain cascades and all sorts of downstream effects. Whereas if we actually just have appropriate breathing mechanics and allow our muscles to remain relaxed in a non-use state, right? So many people have their muscles firing all of the time when they're just standing and doing nothing, when we could actually induce a bit more relaxation so that we don't have trigger points just throughout our entire body. Then our pelvic floor can actually function a little bit better. If you get better movement within your individual toes and get your feet functioning better, you're just more grounded into the earth. That gives you the ability to stabilize your lower extremities, which takes a lot of the load off of the pelvic floor and lets you function a little bit better. So all of these little pieces play into whether or not the pelvic floor functions or doesn't function. It happens in men and women alike.
Is there any sort of, okay. Let me back this up.
Back it up.
Well, because I've heard of pelvic floor therapy. What is that?
Yeah. So typically pelvic floor therapy is referring to physical therapy. So there are lots of pelvic floor PTs. There are lots of really wonderful pelvic floor PTs. There are lots of, unfortunately, it has started to get a little momentum that people are talking about pelvic floor dysfunction. And so some intentional marketing has gone into this where people are like, oh, we have pelvic PT now at our office. And so what they do is take someone who's like a new grad and they run them through like a good course, like a Herman and Wallace course or an APTA course. These are courses for physical therapists to learn more about pelvic anatomy and treatment. And then they'll just put them in charge of the pelvic PT department. And so people are going and they're mostly getting orthopedic PT with a pelvic PT label slapped on it. Typically, pelvic PT or pelvic floor therapy looks like doing internal work. So like with a gloved hand, doing trigger point release inside of the vagina, inside of the rectum, because there's smooth muscle lining that, but then there's also skeletal muscle outside of those areas that can be accessed through the vagina or through the rectum. That's actually not work that I do. I do a ton of work on the pelvic floor just from the outside of the body. So I'm a chiropractor. Wow. That's what my license and degree and all of that is. But then I'm also a DNSP, which is a certified DNS practitioner. So people are starting to know what DNS is because Peter Attia's book, Outlive, he mentions dynamic neuromuscular stabilization. And that's the approach that I use in my practice. And most of that work is all about getting the diaphragm and the pelvic floor to function appropriately through appropriate breathing mechanics. And that's where I've had the greatest success in helping pelvic floor dysfunction. But in general, most of the time, pelvic PT is doing internal work with the pelvic floor. Okay. And so I have a pelvic PT who works in my office. So if someone needs internal work, I send them down the hall and have them go see her. She also does some other wonderful things. And I think sometimes just getting another set of hands and eyes on a patient's case is a good idea. But pelvic PT is typically like below the belt. Whereas orthopedic PT, they might focus on your pelvis or different areas, but they're usually taking more of like a full body approach, the same way that a chiropractor typically takes a more like full body approach. And both have they all have their roles, right? We're all just trying to help people move better and feel better. But when people are talking about pelvic floor therapy, they're usually talking about getting pelvic PT where they do internal work. And this could be also using like biofeedback sensors where they insert a sensor like into the vagina or into the rectum. And they say, okay, now I want you to just breathe and notice how much tension the sensor is showing us that you have in your pelvic floor. So can you try and relax that? And before realizing that there was tension there, the person didn't even have any idea that was happening. And so bringing awareness to the pelvic floor is part of that PT. They can also, work on creating muscle activation through simple palpation, which just means to feel with your hands or with one of the biofeedback sensors. Also with using having the patient do some self-work. So you can do that with a pelvic wand, which if you're looking up a pelvic wand on a work computer, just know that it looks like a dildo. But if you are, it's just, I'm doing this for my pelvic health. But the patient can also do it with their own hand as well. And so that's generally what pelvic floor therapy is. Thank you. Long answer.
No, that's great. No, thank you for clarifying because we hear these terms bandied about.
Yeah.
And at least at my age and being recently perimenopausal 30, and now currently was that?
I said pushing 30, right?
Yeah. Thank you. Mm-hmm. Thank you. No, but being recently very perimenopausal and now being immediately surgically post-perimenopausal, post-menopausal. Anyway, you know what I'm saying? Surgical menopause, what I went through. And so you hear these terms being bandied about and you don't, it's good to get the definitions of them.
Yep.
And so one thing that kind of blew my mind when I was reading your book was the idea that you can have pelvic floor dysfunction and yet you hold tension. Because I was thinking the dysfunction was that you had a complete laxity of everything and it was just all kind of falling to shit. And we're all, we need a girdle,
like that's why this is such a problem, is because people think that there must be weakness here. So I also shared the story in my book about the Arnold Kegel. And so some people say Kegel, whatever, but so he had found that there was a lot of, his patients were having a lot of dysfunction. So he did, he inserted something to register how much tension a patient could generate with their pelvic floor. And they were actually using that as like a early biofeedback. And then he gave them exercises and things to do based off of what they had found in there. And now everybody just like tightens the pelvic floor. Like it's kind of a bastardization of like what originally he had found and was trying to correct with this, idea. And now people just do Kegels. And so we think muscles are weak. We have to strengthen them. We'll just squeeze them and squeeze them and squeeze them. And that'll eventually make them stronger. But let's go back to the bicep idea.
Right.
Eventually, if you did 100 of these at every stoplight and you just flexed your arm on repeat, eventually you'd get a little bit more growth in your biceps. But like, you don't actually strengthen that just by doing its like origin
just
to
by
insertion.
moving. No, you have to lift weight and tear the muscle. And
so there are like programs for vaginal weightlifting, and you can like put things on.
I was going to ask you about that.
And it's not part of a treatment plan that I give to people, but like I don't know how true they are, but I've seen some impressive pictures of like people are like, I have
the lady who lifts the surfboard with her.
Yeah.
Kim
Inami.
Something is her.
Yes.
Inami. That's her name.
Yeah.
Thank you.
Like that's amazing. I mean, I don't know that is what I need to be able to do with my pelvic. I haven't tried to lift a surfboard with my pelvic floor personally.
Right.
I don't have a surfboard.
Or even a skateboard.
I guess that counts. I could try it. I don't know. I like the apparatus that I would need in order to make, I'm not sure about those.
Yeah. It takes some engineering.
Right. Yeah. but the challenge is that we just think that like contracting these muscles is actually going to make a difference. And because it doesn't, we just say, oh, we'll do more of those. Like that's a really terrible recommendation. That doesn't make any sense. So, everybody thinks that pelvic floors must be weak, so when I was talking about if you walk around with your butt clenched all day and you just like butt gripper the whole day, well, eventually you build up trigger points. So trigger points are areas of persistent muscle contracture. So if you have a muscle that is just all of the time on, eventually you'll build up a nodule within kind of the middle of the belly of that muscle that it like you can feel it. There's a little knot there. Usually people can find them in their upper trapezius muscles, like they're
totally
shoulders.
I could do it right now.
Carrying around their shoulders.
There's one.
There's one. Found it. So you can build those up in your pelvic floor by holding tension in your pelvic floor all day. Well, then as soon as you add pressure to that, it's going to give out because a persistently contracted muscle doesn't actually have a lot of strength to it. So if I was even just like carrying around a 5-pound weight all day, I'm a pretty strong person and carrying 5 pounds is no big deal to me. But if I've been carrying around 5 pounds all day and then you throw 25 pounds on me real quick, I might actually just drop the whole thing. Whereas if you gave me 30 pounds and asked me to hold it, I'd definitely be able to hold it, but not necessarily if I've been fatigued by carrying around tension with me all day. So a lot of women are carrying around pelvic floor tension all day, and then a sneeze comes along and they no longer have the ability to maintain function of the muscles that they've just been holding tight all day. So there's a lot of pelvic floor cases where we find that those patients improve significantly once they actually figure out how to relax their pelvic floor, which is the exact opposite of what everyone thinks. Everyone thinks these muscles are weak. Now you can have both. So that's where it gets like really mind blowing, is that you can have a pelvic floor that is so weak that you need to have that you have tension in all day and simultaneously it's weak. Because just because you have tension in your traps doesn't mean that they're strong, right? That doesn't mean you can go shrug 250 pounds. What that means is they're tight. So you can have tension in your pelvic floor and it be weak. And so what we need to do is learn how to relax the pelvic floor and simultaneously get more strength and activation in those muscles. It can be really, really, really complex. But if we start with, okay, let's bring awareness to the pelvic floor, let's bring awareness to the subject matter at hand, and let's start to function appropriately with breathing mechanics, then we can usually kind of clear out some of the noise and allow our patients to really feel what it feels like to have good functioning pelvic floor activity, which then we can start adding in strength building exercises and things of that nature.
So let's say I'm listening to us having this conversation. What's something that somebody can just do if they're sitting in their car or sitting on the subway that right now, what would you tell them to do?
So it just depends if you're the kind of person who doesn't care if people are looking at you or not, because one of the things that is actually really, really, really helpful. So if you are seated and you are by yourself or you don't at all give a shit that anyone is paying attention to you, then you can put your hands underneath your sit bones. Okay. So these are called your ischial tuberosities. But if you like place your hands underneath.
I'm doing it right now.
Right? Yeah, do it right now. Mm-hmm. Okay. So, and you poke up into like either of those bones that are sitting down. So if you're watching,
okay, I feel it.
Here's the skeleton.
Visual aids. Everybody has to watch this on YouTube. give me the views, kids.
These are your ischial tuberosities, and underneath of here is where your pelvic floor is.
Ischial tuberosities.
Yes. So this is your ischium, and these are the tuberosities on your ischium. So what you're going to do is when you're sitting there, you just put your hands underneath one side and underneath the other side. Now, if your arms aren't long enough to reach, that's okay. Just put one hand kind of underneath where you sit. Okay. And what I want you to do is just close your eyes and take a deep breath in.
Okay.
Okay. So you probably didn't feel anything move in your hands. Now what I want you to do is go.
I really I gotta get under.
I gotta get in there.
I gotta get up in the cupcake. You know what I'm saying?
Yes, that's exactly what I'm saying.
That's what I call it, the cupcake.
Right in the cupcake. So
okay.
You probably didn't feel anything when you just took a deep breath in. Ideally, you would. In a normally functioning pelvic floor, the pelvic floor
it felt like it disappeared.
It went away. I don't even know where it
just went away.
The cupcake has just.
I don't think I have a pelvic floor.
I believe 100% that you do. Okay. So now what I want for you to do is go
believing in me.
Make a KH sound, like a k.
Yeah.
Okay, so you felt your pelvic floor move.
Yep.
Oftentimes people will feel it when they do that. Now, close your eyes again and take a deep breath and notice what your pelvic floor does.
It kind of expanded.
Yes. Mm-hmm. It's like the fastest way to bring your brain's attention to your pelvic floor. Most people don't pay attention to their pelvic floor until they're trying to push the baby out of it. Yes. So what you just did was let your brain know that your pelvic floor is connected to what you're doing with your diaphragm. So then when you breathe again, now your pelvic floor is like, oh, okay, I guess this is what I do. So this is a cycle that I'll perpetuate. So I learned that trick from Robert Lardner, who's a PT in Chicago. He's one of the DNS instructors. And so basically I just have my patients beatbox all day. So if you wanted to do that exercise, like on the subway, I think you would just have to do it like with rhythm. So that you can also do a CH sound with that, which typically you feel the KH sound in the back part of the pelvic floor and you feel the CH sound in the front part of the pelvic floor. So if you go, you'll feel it in the back part of the pelvic floor, and then you'll feel it in the front part of the pelvic floor.
Well, now what's interesting is that every time I start to talk,
there's like a pelvic floor move.
Yeah.
Yeah. So
but not the whole time I'm talking,
let your brain know that this is a thing that is happening that you weren't aware of. It's like crazy. Like if you're looking to buy a new car and you're like, you know what, I'd really love a blue Lexus. You see nothing but blue Lexus, right? Because your brain, and they've been there the whole time, but your brain wasn't percepting of those things. And so what we've just done is say, hey, Anna, your pelvic floor does this all the time. Start to pay attention. Now you have more awareness, because if you don't have awareness, you don't have as many choices. And this is, like for life. If you don't realize how many things are available to you, you don't realize what choices you have. So then you just go on autopilot. Whereas if you realize, oh, there's an option here for me to pay attention to what's happening in my pelvic floor. Now, when you're sitting at a red light, once you've done that exercise a couple of times, when you're just sitting there, you don't have to put your hands underneath of you and you can feel your pelvic floor lower into your chair. So if you're sitting at a red light or you're sitting on the bus or the subway or whatever, and you're just sitting, you can start to pay attention to your pelvic floor. So you can be listening to an Eat Happy Kitchen podcast and you can be paying attention to what's happening in your pelvic floor and actually start making your pelvic floor function just more ideally because you're now aware of it. Because like I was saying, most people don't pay attention to their pelvic floor until it's time to push a baby out.
We just had a technical snafu, but we're back. And I will accept complete responsibility because I live in the country now. And every now and then the internet poops out, but it hasn't happened in the middle of an interview. So I apologize for that, Lindsay. Technical snafus aside, which guys, sometimes that happens. And here we are. We're professionals. We're going to finish this conversation because it's so interesting to me. Okay. So the question we talked about, I hope everybody stopped for a second and did that exercise because it's extremely illuminating. Like, my mind is kind of blown. And you have more exercises like that in the book. Obviously, everybody needs to get the book. That goes without saying.
I mean, obviously. I truly want this to be that you could have a conversation with me if you wanted to, because I'm honored enough to be able to, go and teach chiropractors all over the world and to have conversations with patients individually, but I can't actually talk to every single person who wants to know what I've learned about the pelvic floor, but I put it down in 65,000 words. So that should help,
Absolutely. So what about like the laser stuff? Like I've heard of the Mona Lisa and the stuff like that. Is that at all
I'm not as
effective?
familiar with a lot of those things.
They sure
Simply
are
because,
expensive.
well, yeah, I mean, you could spend a lot of money going down a lot of trails and maybe getting somewhere. And that's true across the board. So my approach is one of conservative care. And so that has nothing to do with politics. It's simply the least amount of change that we can make in the body to have the greatest amount of impact. So there are some practitioners who are not at all conservative practitioners, right? A surgeon is not conservative care. We are making drastic and permanent changes to the body when we do surgery. And sometimes that's absolutely necessary, but that's not a conservative option. So if you could use a paperclip to get a job done, then don't bring a sledgehammer. Right. And so sometimes a more conservative option is simply in like the amount of money that you're spending, right? So if it's like, okay, well, I could buy one of those chairs and they do like the muscle stimulation and maybe that'll work. Okay, well, those are a couple $1,000s. You could also instead just like make your musculoskeletal system work better by going to see a chiropractor who understands pelvic floor function or going to see a pelvic PT, right? And that's going to run you like less than $2,000 for a whole treatment plan, regardless of where you are in the country. And so there are mixed reviews on stuff, right? So like you can find studies, and I in one of the chapters of my book, I actually just shared a bunch of studies in as digestible of a way as I could, because you can basically find something to support and something to refute just about every intervention that exists. Mm-hmm. And like I was saying before, we're not easy to study. So oftentimes we put an intervention out there, we try it, we see what happens. You find, oh, it worked really, really great. And then they run the same exact study again. And they're like, oh, this was absolute trash. And every single piece of this fell apart. Like it's inconsistent. There's not a lot of great research backing up a lot of the devices that exist for pelvic floor function. My intention is to use the most conservative means possible to make the biggest amount of change. So if we can change the way that you breathe, your life is not going to be worse by you taking intentional breaths. Right.
It can't hurt.
So
just do it.
Yeah. So if we don't make your pelvic floor dysfunction better, well, we at least gave you a little bit more brain space, right? If your pelvic floor dysfunction doesn't get better, but we at least allowed your autonomic nervous system to kind of find this rest and digest place to exist, I feel pretty good sleeping at night, knowing that an intervention that I did made your life better, even if it didn't make your symptoms better. But if we change your breathing and we can change your pelvic floor function, then why on earth would we do surgery? And even backing it off, why on earth would we insert a pessary? And what a lot of and I shared this in my book, and it is such a cringe-worthy recommendation. I'm guessing that there probably are not a lot of female practitioners that recommend it, but sometimes they'll recommend that you just put a tampon in to serve as a pessary for prolapse or to help with incontinence. Yeah. Can you imagine putting a dry tampon in your dry vagina?
Well, and then and then you pee, and then you're just holding urine inside your
It's just an awful vagina. Recommendation. It's terrible. But
it sounds like bad.
Sometimes are really helpful for patients, but why would we do that if we needed to change your breathing pattern? Right. I actually have a patient.
So interesting.
She got fitted for a pessary. She came in to see me. She was doing really, really great. She had a kind of like relapse of symptoms after a kind of big event sort of happened. And she was like, you know what? I had this appointment. I'm going to go get fitted. She went and tried the pessary, wore it for a day, and it basically just gave her feedback. And she was like, oh, I don't need this anymore. I'm good. I'm done with the pessary. So like we can have these tools, right? But a lot of people, they get fitted for a pessary and they just wear it the rest of their life.
Well,
and
I want to back up for a second.
Their symptoms away. Yeah.
I want to back up for a second. And I want you to define a pessary, but first I have to disclose this. It's so funny that you bring up the pessary, and in my mind, there are no accidents in the world. I narrate for one of the largest medical device manufacturers of gynecological devices.
Yes.
And I just did an entire thing on how to train to insert a pessary, as well as how to do the pessary insertion. What a great So I don't feel like I could do it, but I am actually now familiar. I that's how I learn medical stuff, is by doing medical narrations. And I'm like, oh, that's interesting. I didn't know that stuff. Will you define what a pessary is? So in case somebody hears their doctor say that, you can.
Yeah. So it's a device that you're going to insert so that you can actually give some of your pelvic organs a little bit of support. So oftentimes they'll recommend that you insert a pessary in order to prevent you from leaking, because it kind of almost, for lack of a better word, bolsters the bladder.
Okay.
And so placing that in is going to kind of give a little bit more support to the pelvic organs. So it can be an option. In my mind, I would like to see a pessary be more of a short-term option, because ideally we'd be able to actually make change in the body. And honestly, like, I just function from the standpoint that anything is changeable. And you might not get to 100% function, regardless of like whatever it is that's happening, but everything is at least changeable. And if we can change it in a positive direction, if what that means is like, okay, well, I need to wear a pessary if I fill in the blank, but I don't have to wear it the rest of the day, that to me is a win, right? Because if your life is dependent upon you having a pessary in, can we make that a little bit better? Can that just be a thing that you have to do if you're going to be, fill in the blank with whatever activity is that you want to be doing that tends to exacerbate your pelvic floor dysfunction? But in my ideal world, I'm just always looking to make a patient get to their optimal level of function. If we can get them to their optimal level of function, even if that's not at 100%, I feel pretty good about that. So a pessary is a device that you will insert in order to give support to the pelvic organs. And they're typically given for like ever. It's like you get fitted for a pessary and then maybe you get fitted again in a couple of years, but they're not usually they're not typically given as a short-term crutch. They're typically given as a long-term solution.
Thank you for defining that, because I think that there are conversations and there's things that you hear, like you hear about the mesh.
Yeah. Oh no, Anna. You're back.
We're back. We're having a good time with internet. I did the same thing that you did, which is I just vamped on through it. And when I hear that, don't worry, I will cut it together and we're going to sound like absolute rock stars that had zero tech issues. Okay.
Perfect.
Thank you.
Okay.
I'm gonna murder Xfinity. I'm doing murder to Xfinity. We're gonna wrap this up, but here's the thing. I want to ask you, do you do consults? Do you teach courses? What's the best way for people to follow your work? Obviously, besides getting the book, which everyone who's listening is going to go get the book. Go get the book.
Go get the book. So I teach chiropractors. The classes that I have for the general population, I have a postpartum rehabilitation course that I actually just send a lot of people to because it's a core and pelvic floor recovery class. And so the reason why a lot of women have pelvic floor dysfunction, as you stated earlier, is because of all the things that they go through during pregnancy and birth. But there are plenty of people who have pelvic floor dysfunction who didn't go through that process. In general, postpartum health is something that, like pelvic floor dysfunction, is not really well understood. So I think it doesn't hurt people to take a postpartum rehab class, even if they have never given birth or never want to. There are plenty of men who have taken that course, because if you have abdominal surgery, I recommend my patients take that course, because I just haven't made another core and pelvic floor recovery class. And I figure it doesn't hurt you to learn about postpartum things too. So, and then I also have a caregivers course, which is I co-created that with a colleague of mine. And I have a handful of classes. I can send you some of those. The one that does the most for pelvic floor recovery is my postpartum rehab course. I'm in the works of creating.
Can you be menopausal and do that?
Oh yeah, absolutely.
You can be at any stage of life and feel like that could help. But you don't have to have just had a baby. Okay.
Nope, you do not have to have just had a baby, and you don't even have to have ever given given birth at any point in time. Men post-surgically take that course. Men after pelvic strain take that course, and I actually have a lot of doctors who take that course because they want to know better how to help their patients, and so that's a resource that I give to them. I'm making Your Pelvic Floor Sucks the course for practitioners to be able to take. I will start teaching that course next year in 2025. But I don't have one for general population yet. I kind of want to see what happens with human genetics when they're looking to publish my book, and see what what that looks like before I, take next steps. In the meantime, I just, show up on podcasts and keep writing in my Substack. And
Oh yeah. Well, you're going to send me the links to everything, which I'm
Yeah.
going to link to in the show notes. So you guys can find Lindsay's work, get your pelvic floor sucks. And, I guess you kind of answered my final question, which is there any time, obviously today is the best day to get started, but is there any time for, if there's any younger people listening?
Yeah.
Will this help prevent future crap?
So there's a little bit of research that shows us that doing some preventive work for the pelvic floor can prevent postpartum incontinence. So this is for women who have not yet gotten pregnant, if they do some work, and then also during pregnancy, if they do work for their pelvic floor, that it can kind of stave off postpartum incontinence. But once again, because the pelvic floor is such an integral part of how we move throughout the world, right? Like if I were to walk across the room right now, one side of my pelvic floor is doing something different from the other side of my pelvic floor. One side of my pelvic floor is functioning in stability, and one side of my pelvic floor is functioning in movement. So the more that I can just even start to pay attention to this area, the better off I'm going to be as a bipedal creature. So then as a bipedal creature who gets pregnant and then gives birth, right? Like the more awareness that I have in my own body, the better off I'm going to be. So it doesn't hurt anybody to start at any point in time to gather like better awareness and then begin to take care of this really important part of your body.
I feel so glad that you have made this part of your life's work so that we can all benefit from it. You know what I mean? Because I mean, like, who would think it? But I'm telling you, the first time, at least as a mom, that you realize like I'm not going to participate in the trampoline party because had that, you know what I mean? Yeah. Or like going to, for me, doing video games and stuff. And when I have to do exertion noises, the first time I realized, like when they had me do like really hard exertion noises or dying noises, that I was like, oh my God, and I was like, oh, I need to take 5. I have to pee. Like, I was like, like, this is my work. Like, I can't pee my pants at work.
Embarrassing. Right. Yeah. But the same question goes back to your elbow. Like when you made exertion noises and you're trying to get paid for voiceovers, you're like, oh, that's a problem. Right?
That's embarrassing.
You would bring it up to people and say like, I got something going on here. Right. Like you're not embarrassed to say my back hurts or my neck hurts, but we're embarrassed to say my pelvic floor is leaking. But this is a musculoskeletal problem most of the time. So the same way that you would deal with a knee pain or backache, like we have to be able to address this. And that's what I tell chiropractors whenever I'm teaching them. You're an expert in musculoskeletal care. This is that. It's just inconveniently located. So we need to really like brush up our skills on how we're going to take care of this area of the body that a lot of people are suffering from.
And destigmatize the conversation surrounding it. So thank you for being a part of that. And I hope everybody feels a little less. I think we would walk around too with that kind of internalized, stigmatization, internalized self-misogyny, I guess, where we're like, oh, that's gross. I must be gross now, or that's not cute or sexual or anything that's fun. And listen, we're sex positive over here at the Eat Happy Kitchen. We want people to have fun sex in their relationships and everybody having a good time. You know, that's part of one of the beautiful things of life. And if you're not enjoying that, if that's the first indicator, but oftentimes it's the kids had a trampoline party and I was like, nope.
And that's actually
not
the question
doing
that I
that
ask
one.
Because I know that they're underreporting. So when I ask people, do you leak any amount of urine when you laugh, jump, cough, or sneeze? No. Okay. So if we went to a trampoline park, would you participate? Well, I'm like, yeah, okay. So there's some
hard pass
we doing here.
Yeah,
and I
totally.
too, just like recognizing that one of the things I talk about in my book is hand waving. Like people just hand wave, like, oh, that's just one of those things after you have kids. And that'll, you'll just deal with that. Like, I'll just put a pad on. No, we need to stop hand waving this and actually take care of it.
There's a show called Colin from Accounts that I've been watching. It's this Australian show. And in it, one of the leads is she is a doctor in training. I don't know if she's in a residency or whatever, but one of her jobs is that she has to stitch up the perineum of the women who've given birth. And, it's a comedy and it's Australian, so it's very dry. And every time they show it, it's a dad asking for like, hey, can you put in the extra stitch for me? And she's like, like you're like, you're the first guy who's ever said that. Yeah. And it was like, oh God, it's one of those things where, but she obviously it's a joke to comment on the fact that there's tremendous shame surrounding, oh,
Yes.
am I still going to get to be sexual after I have a baby? Am I going to pee my pants? Is all this stuff going to happen? And so just the fact that you're talking about this, I think is just, it's so wonderful. Thank you.
Yeah. Well, I really just, I have a hard time keeping my mouth shut, so I want to,
well, God bless
I get
you.
excited
Me too,
about
honey.
ideas. And I just want to keep talking about it. So yeah, thank you.
Too.
And thank you for having me here, because
oh my God,
really
thank you for being here. Everybody get your
audience.
Pelvic Floor Sucks. You're going to love it. And you're going to everybody do that breathing exercise. If you didn't do that breathing exercise, that's so easy. Go back and do it. And then she has tons more in the book. So thank you for being here.
Anna. I appreciate you.